The New York City Health and Hospitals Capital Committee. Today's meeting, today's meeting is officially called to order. Please note for the record that Dr. Michelle Allen is representing Dr. Katz in a voting capacity. So I would like to propose a motion to adopt the minutes of the Capital Committee meeting held on June 5th, 2023. All in favor, please say yes.
Yes.
Opposed, say no. So, minutes approved. And next, we have several resolutions to consider. So I'll start with the second bullet point in the action items.
Okay,
MVP
so,
resolution. MVP, yeah.
yes, so I'll read the proposed resolution. It is authorizing New York City Health and Hospitals Corporation to sign a 5-year license terminable by the system without cause with K&M Medical PLLC Group, which does business under the name Mobile Vascular Physicians, or MVP, for MVP's use of 414 square feet at New York City Health and Hospitals Carter, 216 square feet at New York City Health and Hospitals Kohler, 120 square feet at New York City Hospitals McKinney, and 125 square feet at New York City Health and Hospitals Seaview as examination rooms in connection with MVP's vein care practice at initial rates of $47 a square foot at Carter, $57 per square foot at Kohler, $25 per square foot at McKinney, and $40 per square foot at Seaview for an initial yearly fee of $47,859 for the 4 spaces, to increase by 3% per year for a total over the 5-year term for the 4 spaces of $177,698. And now Dr. Luong will give the presentation.
Thank you. Thank you, Jeremy. Thank you, board. So the overview of the proposal involves dialysis patients and their dialysis access. So currently, when there's an issue or care involving dialysis access, the patient is taken off-site to either a clinic, a freestanding clinic, an ambulatory surgical center, or a hospital clinic for this care to be rendered. The proposed resolution today provides for H&H to license exam rooms in 4 of the post-acute facilities where mobile vascular physicians will provide vascular care to patients on site. The 4 post-acute facilities that this involves are Carter, Kohler, McKinney, and Seaview. While being treated in these leased examining space, the patients will be treated as mobile vascular physician patients. Mobile vascular physicians will also bill third-party payers as they will treating patients in their own office. They will document in their own medical record, and then they will coordinate care with us at the conclusion of that visit, where we will accept all instructions and documentations, and then scan it into our electronic medical record. Concurrently, but not included in this resolution, is the service agreement between mobile vascular physicians, where they will provide care to the system's patients at bedside. And so this agreement will cover all of the post-acute facilities, skilled nursing facilities, and I'd like to highlight that this is the way that Gouverneur patients, not included in this resolution, will get the care on site at bedside. So about the provider, there are not a lot of dialysis vascular surgeons who provide care in the skilled nursing facility. It's a very niche area. So a mobile vascular physician is a regional provider. Their team comprises interventional radiologists, vascular surgeons, and they today have served over 340,000 patients in 273 locations. They're well known and well respected within the provider community. The procedures that are commonly performed on this population of patients include access creation, access surveillance, access maturation assistance for veins that fail to dilate, clot removal, angioplasty, and the placement of and removal of dialysis catheters as needed. So these are the procedures that will be assessed for on site. These procedures themselves are not performed on site. They're performed in an ambulatory surgical center. Mobile vascular physicians provide care in the boroughs of Queens, Bronx, and Brooklyn. So the license terms would be one license covering 4 facilities. Mentioned before, Gouverneur is not included in this. The reason being is that the facility could not identify suitable space for mobile vascular physicians to conduct these examinations. This will be a 5-year term, and we're anticipating the commencement of it December 1st, 2023. And we provided a table showing the fair market value occupancy fee for the total of square footage for each facility that's being requested, the breakdown of the dollar amount per square foot, and the cost of year 1, along with what it looks like over 5 years. That concludes my proposal.
Thank you so much. Any questions?
Just 2 quick questions. There's enough business generated, so it's worth their while setting this up?
Yeah, they have replicated this model in other multiple facilities, and we've shared with them our dialysis population. And being that we provide dialysis in 2 ways, one is also on site,
Right.
and then also an in-center conventional model, which is off-site. And we have a sizable dialysis population where they see that this would be like the operation or the volume could be supported by this operation.
And are they also doing it at bedside at these 4 sites?
Yeah, they conduct the exam, only the physical exam, and then from that physical exam, they make the surgical recommendations. The surgical recommendations are then carried out at an ambulatory surgical center. But our real experience now is getting the appointment for the surgical assessment. The time period or turnaround could be like 3 or 4 months, and then you have a few more months to schedule the surgical procedure. During that time, we've seen a number of clinical outcomes that we feel are related to just the long turnaround time, like hospitalizations, patient developing sepsis, or just morbidity from a dysfunctional catheter access.
Okay, thank you.
Could you summarize for me what's done at the bedside and what's done at the surgery center?
Sure. So at the bedside, I would just think it would just be a bedside exam. There are no procedures that are done, even minor. And so, it's mainly the history taking and physical examination would be done there. Collateral and care coordination could be done there. But the procedures that typically they do perform, which is included on the second slide, would be access creation, also just surveillance of the access, looking at the maturation of the access, any clot removals, dilations, angioplasty, or placement and removal of a dialysis catheter. These are the non-fistula related access.
So,
And that's done in the surgical center.
so the RFP has to do with Carter, Kohler, McKinney, and Seaview.
For the least exam space.
But they, in another contract, they are providing services for Gouv.
Right, yes, that's how Gouv would get this care on site, but it also extends to the other 4 facilities. So the other 4 have 2 options where it could be done in the room, the license room, or at bedside. Gouverneur is only at the bedside.
I see. Okay. Thank you.
Thank you. Okay, let me then ask for a vote. All in favor, please say yes.
Yes.
Opposed, say no. So the resolution carries. Thank you so much.
Thank you for the support.
So the next one, be the first one in action item Tasty Picks.
Let me just say that Christine Contreras, the executive director of Metropolitan Hospital, would have been here today to present this herself, but unexpectedly a press event was put on her calendar by the, I think they call her Deputy Speaker, Ayala, and so she and Dr. Katz were at Metropolitan like a half an hour ago, and so not enough time to be there and make it back downtown in time for this meeting. So she's sent Alexis Hernandez, the communications lead for Metropolitan, to just kind of represent the facility, and Leora Yontef and I will read the resolution and make the presentation. So the resolution that's proposed is authorizing New York City Health and Hospitals Corporation to sign a 5-year license agreement with Tasty Picks Number 2 for its use and occupancy of 2,500 square feet at New York City Health and Hospitals Metropolitan for a retail food operation at an initial rate of $30 per square foot or $74,400 per year, to increase by 2% per year for a total occupancy fee over the term of $107,723.63. Such agreement to be terminable by either party on 30 days' notice, without cause. So this is, one more in the series of food service resolutions that we've brought to the board. I think next month we'll have another couple. So this is, part of the continuing effort to go to our hospitals and respond to their need for either new vendors to provide food within the hospital or for renewals of existing arrangements. And what we've seen around the system is a lot of kind of old agreements that are expired. Maybe the vendors left because of the dearth of business during the COVID epidemic, or they've just kind of petered out. They're old relationships that kind of need a shot of energy, and so hospitals are moving out the prior vendor in some cases and bringing in a new vendor. And at Metropolitan, there had been no vendor at all, and so there were a lot of complaints from Metropolitan staff that there wasn't food available. These are people that work 24 hours a day, at odd hours when other food options are not available. So we took the first step to address the situation at Metropolitan several months ago, when we brought to the board a proposal for every table another food vendor to operate a small kiosk on the First Avenue side of the hospital. And so that's kind of step one in putting in place a proper food service arrangement in Metropolitan. Now, Tasty Picks is the second part of that solution. Tasty Picks will operate at the exact opposite side of the hospital, the Second Avenue side, and Tasty Picks will run a fuller operation. There will be a sit-down restaurant, and whereas every table is kind of a grab-and-go kiosk. And so when we gave the presentation, the briefing to the board, the question was raised, is there business within Metropolitan for both of these operations? And I would say the test of that is that both of these operators are aware that the other is going to be in the hospital. They were both willing to proceed on that basis. So, who better to judge the business prospects than the vendor who are putting their money on the line. For these kinds of arrangements, we don't do RFPs. Each hospital individually seeks out the best vendor available, and Metropolitan has really kind of had a hard time finding a proper vendor. We went through extensive negotiations with another local vendor that in the end collapsed. So happy to be able to get every table in place. And now when Christina Contreras moved from NCB to Metropolitan, she was uh, reminded of what a good fit Tasty Picks had been at NCB. Tasty Picks, a local vendor that apparently provides offerings that are very, very sensitive to the local community styles and tastes. And so Ms. Contreras was able to persuade Tasty Picks to come down to Metropolitan as well. And um, so um, that's the basis for the selection of Tasty Picks. And you can see on, yes, this slide that's up, an example of the menu items that will be offered and, you know, really quite inexpensive. And that's been the theme for all of these food service businesses, is to find vendors that are willing to offer very economical choices. And we prioritized having offerings that are affordable to staff over the possibility of generating more income for the hospital. You know, the amount of income that would have been generated, that could conceivably be generated, is kind of negligible in the context of the hospital operation, whereas providing this service to staff is a much higher priority. Um, so Tasty Picks will operate in 2,500 square feet on the First Avenue. I'm reading in the First Avenue Mental Health Building, but near the Second Avenue entrance. They'll spend about $250,000 to fix up the space, and they will pay $6,200 a month, and it'll be a 5-year deal, as I say, terminable by either party for convenience. So that's our presentation, and welcome any questions.
From an OFD perspective, it's 2,500 square feet for a restaurant. That seems small. 2,500 square feet.
It's pretty large.
Pretty big.
It's a decent size.
Okay, that was just my question.
Considering
The
what it is.
experts. Okay. And they want to have a kiosk plus the restaurant.
So there's going to be the kiosk operates like 50 square feet.
Yeah. So,
And so this is, you know, considerably bigger and, you know, addressing different appetites and needs.
so this is out of curiosity. Many of our sites have OBOM PAN. Was that a central office contract or facility specific? And why would we not do it system-wide, go into contract with a single vendor for all our hospitals, so a hospital like Metropolitan doesn't get left out of the business?
Well, that's a very good question. And I have to say that some folks in supply chain have been trying for actually several years to put in place a central contract. There was a lot of effort put into getting Sodexo to make a contract across the system, and it was difficult to do that because, for example, Kings and Bellevue, for example, bigger hospitals with more volume actually can generate revenue and can do something more ambitious for their staff and produce some income for the hospital. But then you have hospitals like Metropolitan and NCB that, you know, basically have to be subsidized by the bigger hospitals. And so that, you can imagine, that produced a certain amount of tension. And, you know, maybe, you know, it could have been done, but it just was taking too long. And so with this individual approach, we've been, you see, we just keep bringing more to the board. And um, so going back to the previous question about Obon Pan, that was not a centralized approach. That was individual hospitals
Went to the
making
same.
those agreements. And um, so in a way, we're continuing that that decentralized approach, although we're doing the contracts centrally, whereas in the past they were done at the local level.
I will just, for the record, express an opinion that if we functioned as a system, perhaps it's not such a bad idea to subsidize the smaller hospitals with the revenue from the larger hospitals, because we might actually spend less if we have one contract for everybody than these multiple. I haven't done the analysis, but just thinking about it, you might save money, so this expenditure is not so large. And it's not such a bad idea that the big brother helps the little sister.
You're a socialist.
Any other questions?
No,
or comments?
thanks.
Uh, yeah, anyway, well, let me ask for a vote. All in favor, please say yes.
Yes.
Opposed, say no. Thank you so much. Thank you. Okay, so the next one, Manny?
Thank you. Good morning, everybody. These two resolutions, I'll read off. Authorizing New York City Health and Hospitals Corporation to execute a requirements contract with Gemco Electrical Contractors for a not-to-exceed amount of $10 million to provide general construction services on an as-needed basis at various New York City Health and Hospitals facilities for over a term of 2 years. The second resolution is authorizing New York City Health and Hospitals Corporation to execute a requirements contract with BA Global Construction Corp. For a not-to-exceed amount of $10 million to provide general construction services on an as-needed basis at various New York City Health and Hospitals facilities for over the term of 2 years. And with that, I'll hand over the presentation to Menji and Oscar.
Thank you.
but Menji can take over now. Thank you.
Good morning. So job order contracts are contracts that we award based on a public bid. The bidders use a multiplier to bid on a catalog of services to establish their base bids. And typically, these contracts are used by the system for smaller projects or urgent projects that are time sensitive. The current contracts were awarded back in 2019 and expired at the end of this year. The utilization for the contracts we have, you can see in the table. The total pool of $30 million were almost at 85% of the contract value, and 2 of the contracts are nearly at 100%. Next slide. This is the procurement detail and timeline. 2 separate bids were opened on May 17th and May 23rd for 2 separate contracts, each for $10 million to provide general construction services. Gemco Electrical Contractor was the lowest bid for the bid opened on May 17th. They submitted a multiplier of 0.70. Gemco is currently our JOX Electrical Contractor, or actually had a more recent contract from 2020 to 2022. And they also served as a previous JOX General Contractor from 2018 to 2020. Evaluations for both of those contracts were 84% and 93% respectively. Additionally, in MOX, they have 2 excellent and 4 good ratings. BA Global was the lowest responsible bidder for the second contract, which bid was opened on May 23rd. The multiplier they submitted was 0.67. They're currently one of our JOX GC contractors, and evaluations for that contract puts them at 87.5%. They're also currently 2 prime contractors for the King's Pharmacy and Woodhall Facade project. Next slide. This just summarizes the evaluation based on the scale that we have. Gemco is excellent, and the next slide shows BA Global at good. Next slide. This is the MWBE utilization plan for the 2 contracts. Gemco has committed to a 41% MWBE plan with the subs listed below on the table you see in front of you. BA Global is a certified MWBE, so 100% of their spend will be towards their MWBE utilization. And the last slide is the resolution again. So happy to take any questions.
Any questions on this one?
No.
No questions?
No.
Okay, so let me ask for a vote. All in favor, say yes.
Yes.
Opposed, say no.
Yeah,
Resolution
I said
carries.
yes.
Ah,
I
you
said
said-
yes, yeah,
You say yes, yeah.
okay.
Thank you.
Resolution carries. Thank you so much. And the last one?
Okay, this resolution is authorizing New York City Health and Hospitals Corporation to execute a contract with Gemco Electrical Contractors to undertake a renovation of behavioral health units located on the 12th, 18th, and 20th floors of New York City Hospital's Bellevue Hospital to create a ligature-resistant environment for a contract amount of $12,779,569 with a 10% contingency of $1,277,956 to bring the total cost not to exceed $14,057,525. And with that, I'll hand over the presentation to Aniqua Brown, who's our Senior Director for OSD and is responsible for Bellevue.
Good morning. So as a program background in history, Bellevue in particular provides health care to underserved New Yorkers with mental health issues. Its inpatient behavioral health units are located on the southeast corner of 30th Street and First Avenue. During the mid-1980s, the 12th, 18th, and 20th floors were built out as new behavioral health inpatient units. Currently, we are looking to upgrade the aging facility to better meet the needs of the vulnerable population. As a result, it is necessary to complete a full renovation of all inpatient units located within Bellevue to mitigate the ligature risk and provide health care in a safe environment. Just to provide clarity in terms of how we define ligature resistant, is the removal of any furniture, equipment, fixtures that create ligature points where a cord, rope, bed sheet, or other material can be looped or tied to a fashion point or attachment that may lead to loss of life or self-harm. In terms of our construction scope and schedule, we're looking to renovate 6 of our interior units. The scope will include demolition of our interior spaces, replacement of exterior windows with behavioral health grade compliant glazing, replacing the glazing we also have interior windows, so we're replacing that glazing as well. We're upgrading the bathrooms to include ligature resistant fixtures. We're installing solid surface sink bases and enclosure, also with tamper-proof screws, also to mitigate ligature risk. We're updating our finishes, millwork, and hardware to behavioral health's new compliance standard, including continuous hinges and anti-ligature resistant handles. The project will have no impact to our bed count as we're completing the project in phases, and we're expecting to start no later than January 2024 with completion by the summer of 2025. So here we're showing our current state of affairs on the left and the future state of what we anticipate the anti-ligature spaces to look like in its future state. Overview of procurement. In late April, we had 2 site visits with bidders. 4 contractors attended, and we received 4 bids. Ultimately, in early August, we had a pre-award meeting with Gemco Electrical Contractors, who we deemed as the lowest responsible and responsive bidder. So in terms of how this contract was procured, it was in fact a public bid. Gemco was the lowest of 4 bidders. They have committed to and proposed a 32% MWBE subcontractor utilization plan to a total of $4,071,747. The total contract amount would be for $12,724,208. Gemco is currently one of our JOCS contractors as well, and we did an analysis of recent evaluations that were completed, and they received 2 excellent and 4 good, with an overall rating of both 84 and 93%. So they've done quite well in our facilities, and again, we're expecting to start in January of next year and complete in summer 2025. This is just an example of one of our latest performance evaluations, ultimately showing an excellent rating. In terms of the budget, again, construction costs is contracted for $12,779,569. We're looking for a 10% project contingency at $1,277,956 for a total budget cost approval for $14,057,525. So ultimately, we're looking to request for approval to execute a contract with Jimco Electrical Contractors to undertake a renovation of the behavioral health units located on the 12th, 18th, and 20th floors to create a ligature-resistant environment for a contract amount of $12,779,569 with a 10% contingency of $1,277,956 to bring the total cost not to exceed $14,057,525.
Thank you. Any
Yes.
questions?
So have we completed one unit at Bellevue so far, 18 North or?
We have completed 1 or 2 units to date using our JOCS contractors. So it wasn't done via competitive bid, but we've been able to put a set of drawings together so we can get a more competitive number, and they'll be able to do 6 units in the next phase.
And they'll finish when?
Summer 2025. It's 6 units, so we'll complete them over time and turn them over as they're completed.
Thank you. I don't have any other questions.
I have 2 quick questions. How many individual rooms are there altogether?
Ooh, that's a great question.
I think it's on average, it's about 26, 27 patients per unit.
Per unit.
Yeah, that's been my experiences with
Yeah.
BH.
And
So,
is Bellevue like a little behind the times in its ligature proofness? I mean, is it because this was in the 80s that it was last done? That
I think we don't have any of the BH folks here, but I think what happens is the regulatory aspects of the anti-ligature change so often.
Right.
So when the building was built, when the units were built, yes, they did get very dated, and now so to try and get everything up to today's standards, today's codes, we're essentially trying to catch up. But whatever it is that we do today, fast forward another 20, 30 years, the regulations.
You're going to have the same issue with
They
other
actually,
hospitals?
so it's not just the ligature, it's the entire unit needed to be upgraded. So this stemmed from a particular incident where a patient actually took a table and weaponized it, broke through a door. So we are doing the windows, we're doing the tables, the chairs, so that the units are much more safer above and beyond ligature risks.
But we're not doing this in all the hospitals. We're doing it
We're
'cause
starting here because this is where the citation was.
occurred. Okay, thank you, that was it.
Thank you, Dr.
Oh, what happened to Volmer? We don't want to use we don't need an extra 10 million or,
You mean for the jocks?
yeah.
Sorry, so,
I'm sorry, before we had 3 companies that we used. We used Volmer, BA.
correct.
Yeah.
So we have a third contract that we're still working through with the vendor.
Oh,
So
okay,
we anticipate, depending on how that resolves itself, we may bring that to the board or we may rebid it.
okay.
But for the anti-ligature, this is a standalone procurement, separate from the jocks order
Yes, I
contract.
hear you.
So, yeah, okay.
Thank you. Okay, let's take it for a vote. All in favor, please say yes.
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 Opposed, say no. Resolution carries. Thank you so much.
Thank you.
Next, the Vice President's report.
Okay, thank you. As we've closed out our fiscal year on June 30th, we are reflecting on the accomplishments of our facilities development team this past year. On the capital front, there have been tremendous efforts in partnership with our colleagues in finance. Our capital budget and payments teams facilitated the commitment of over $507 million in capital contracts, representing over 1,169 purchase orders. Of these contracts, approximately $349 million is city capital, and our infrastructure commitment rate for FY23 was 73%. Our payment teams processed over 4,300 payment vouchers this year, which is a 71% increase in transactions when compared to the 2,500 that were processed last fiscal year. Our budget team was able to authorize over $482 million, $460 million of city capital and $22 million in non-city capital, In infrastructure-related budget expenditures, a slight increase from the previous year of $467 million. For the status of our bond portfolio, we have 10 projects in active construction and 22 in substantial completion, with all projects estimated to be substantial completion by the end of this calendar year. Our facilities operations teams continue to work hard in preparing for the upcoming Joint Commission surveys at Carter, Coney Island, South Brooklyn, Lincoln, and Kings County. This fiscal year, we are working in earnest to move forward with Brooklyn Borough President Reynoso's generous contribution to our capital program at 3 of our Brooklyn acute care hospitals, Woodhull, South Brooklyn, and Kings County. With this funding, we will make major modifications to our labor and delivery units of these 3 facilities to improve clinical workflow and the patient experience. We are also finalizing the contracts for our system-wide master planning pool and expected to have these services available for use by our facilities at the end of this fiscal year. We have presented 4 items: the job order contracts for general contracting services, construction, anti-literature support at Bellevue, bringing new health options for Metropolitan, and leasing space for the mobile vascular program at Carter, Kohler, McKinney, and Seaview. And that concludes my report.
Thank you so much.
Thank you.
Any comments or, yes?
This system-wide master planning, is that one we approved that we're gonna set priorities by borough?
Yes.
Yeah. So what does it mean when you say you're finalizing the contracts for our system-wide master planning pool? What do those contracts provide for?
So we're finalizing the language in all those agreements, and that's currently working with legal with what we had presented earlier in the year. So, Oscar, can you
Yeah,
provide a more
so
detailed
we have
update?
several different vendors on each particular pool, okay, and each one of those vendors will have a contract. Once that pool is executed and registered with the controller's office, what we do is we'll do a mini RFP within the pool to assign that particular vendor to a particular facility, and then they will start the master planning services. Every master plan is going to be different. Some facilities are small, some are large.
Right.
So the time constraints are going to be very different. We also have to see the bandwidth that the consultants have. Like, for example, Array right now does a lot of work for us. I don't know if I can give Array another assignment for another master contract because I'm going to be draining the resources. So while we have the pools in place, we're able to manage and see, how we can start rolling out some of these master plans.
This confuses me, and I'm struggling to understand. You got the facilities, and they have their idea of what their priorities and capital projects should be. We've got our independent consultant that's gonna weigh in on what each facility's priorities should be, what we should fund. We're making an overarching decision about where we wanna invest our capital in each of the 5 boroughs. Is that how it works?
So I can answer part of that. I think the way that we look at it is the facilities have the priorities over what they feel that they need and want at their sites.
Right.
I think this exercise is giving us the potential of what we can do with the entire site, helping them enhance the way they think about their space,
Right.
and maybe providing more of a critical eye and an outside view over the potential of their space, right? Like Kings County, for example, is one of the campuses that we feel that we have the most potential with because of its bandwidth and size. And while the local team might have priorities over what they feel that needs to happen capital-wise, the outside view from an expert consultant might help them enhance their thinking by understanding the potential of everything that exists at that site. Does that make
And
sense?
do we have makes great sense. And do we have like a pool of money, or like, how do we know how much we can afford to allocate to the projects? Are we doing it by time?
So I'll let Oscar provide a little more of those details there, right? Just so you can have some ideas.
We did do an estimate, and we did kick off 2 master plans already, one for Elmhurst, one for Queens. So we
okay,
do
yeah,
have an idea of how much it costs. Unfortunately, master planning is considered planning in itself, so it's not necessarily capital eligible. It doesn't necessarily yield an asset. What it will yield is an overall clinical assessment plan of what we can do at each particular campus, and then sort of go and kind of like an a la carte menu. Okay, so that way now we have the potential how we can grow, how we can shift, how we can swap spaces. We can go to knock some doors at the elected officials, the bar presidents, the council members, and say, would you fund this? Would you help me advocate for that? And maybe we just get one of the entire master plan, or maybe we get everything. So this is where that master plan becomes very helpful.
And has the capital committee seen the 2 master plans that you've done, or is it too voluminous, or we have seen it?
Dr. Katz has seen the one from Elmhurst, and he has seen just a midpoint check-in for.
Okay, well, when it's appropriate, it'd be interesting to know what they look like, to get
Yeah.
a flavor for how this thing.
Follow up on that, which is like, and refresh my memory on this, like, trying to understand the timeline of the master planning.
How long it takes to do?
So, because I remember that they were gonna be, well, was it several years, and then how was it mapped out? I mean, just a rough,
we were looking to roll out about 2 or 3 master plans per site, and the time frame associated, depending on the size of the facilities, anywhere between 1 to 2 years. The likes of Metropolitan would probably be 1 year. Kings would be 2 years, just to give you an example.
Anything else?
No, that's,
Okay. And we'll make note that somehow, let's figure out a way to share some information
yeah.
connected to the master
It'd
planning
be
and
interesting to see how that translates.
how it works. And
Yeah.
thank you. Okay, so thank you for your report. Thank you for the impressive work that the whole team is doing. And
Thank you.
And
Thank this too, as well.
it's just you are a very busy team. So any old or new business to come before this
How are you
committee?
doing on staffing?
Staffing is always a challenge, not only in terms of being able to kind of move things through, but really finding the right talent and the right
Yeah,
fit for our
sure.
organization. Right? A lot of folks want to join our organization, but we have a very expert team, a very in-depth team, a very collaborative team, and finding the right fit is not always available for us. But we've had really good success
Great.
over a good portion of this year, and of course, we turn over a little bit, so we'll look to aggressively keep working with HR in the fall.
So Sally, I have to say, as a customer, they're a great team to work with. They're really responsive. They understand the questions, and they get back to you in a timely fashion, and they deliver. Really a wonderful team as a customer to work with.
That's great to hear.
So thank you very much. It's very nice.
Okay, so any old business or new business to come before the committee? And no further discussion, then the meeting is adjourned. Thank you so much.
Thank you.
Thank you.
Thank you.